everybody. It's a beautiful windy day. It's less than 60% humidity, which for me means beautiful. Here in San Antonio, Texas. My name is Suzanne Ullman and I'm a heart failure nurse, and I'm here to answer some questions that were posed to me by a friend on El Facebook about what is happening, because I think we're good almost 2 months into the national awareness of the severity of everything going on in the COVID pandemic. And so, as with anything, there's constant change and thus more questions. My guest hosts today are Lil Fui and Pablo. They've already had their walk, so they're very well behaved. Okay, so one of the first questions I was asked was, will this take a year or more? My guess is yes. If you look back 100 years ago and read about the Spanish flu and the way it manifested, it came in 3 waves. Now, the Spanish flu is close to my heart because my dear grandmother Faye lost her mommy at 5. Her mommy died, was pregnant, and died of the Spanish flu in rural Nebraska. And I would wager that pretty much everyone can mention someone in their ancestry who was killed or affected by the Spanish flu. Okay, so the fact that it's going to take longer than just these 2 months of change is really stressful, and we don't have all the answers to how that's going to manifest in our daily lives. We just know it is, and that's really disconcerting. I wish there were more scientific information I could give you, but I am not an infectious disease specialist. I know that labs, pharmaceutical companies, infectious disease specialists, and scientists are working day and night to develop a vaccine, and that's going to be the game changer. Because what we want is herd immunity, either through vaccine or through a good percentage of people having had it and developed immunity, and then the rest of us will benefit from that. And that just doesn't happen overnight. Let me just say that viruses are wily little sons of guns, okay? There have been coronaviruses in existence for a long time. This one is making itself known because of its incredibly fast spread, some of the ways it manifests in those who get it, and the complications it can cause. And that's the thing. We might develop a vaccine for this strain, but the thing about viruses is they constantly change and evolve. So that's not to scare you, that's just to humble you to the reality that the scientists are dealing with. This is not just a shrug and an overnight like, oh, this will fix it. I apologize. The UPS man has pulled up across the street and it's very offensive to the dogs. Okay. Is there a cure that's worse than the actual virus? I think that this question... Pablo, stop. He's doing his job. Now he's barking the other direction, just because once stimulated, why not? Look at his... Pablo. Okay, so I think this is a... Okay. I don't know. Pablo! Shh. Okay, is there a cure worse than the virus? First of all, it's pretty hard to cure a virus. There are vaccines that can prevent people from getting it, and some viruses have treatments. But I think this question is in reference to the whole hydroxychloroquine, which is the generic name for Plaquenil. It's just an unfortunate thing that got such attention so quickly by political leaders, because unfortunately, like a lot of medications, the side effects can be profound, especially for someone with heart problems, and it can make the patient feel god-awful. And there isn't enough data to say that it's actually going to help the way it does with malaria, which, P.S., is not a virus. Okay. So, another question is, are people dying because of COVID patients getting more attention? I don't know a statistical answer to this. I do know that people are visiting the emergency room less because they don't want to go to the hospital. I know that in the hospital, my husband was just in the hospital on Monday for surgery, and it was very quiet, and this is a big public hospital. Very few people. They triaged everyone who came in as a visitor like me. When I came to pick him up, they took my temperature. So there are systems set up, but I don't believe that people, it's not like the battlefield where it's like wartime triage. And so I know that that's a concern, but my sense, just as a medical provider and as someone who was recently in our big, beautiful public hospital here, I don't think that's happening. So this is already almost 6 minutes long. I'm gonna stop and I'm gonna address some of the other questions that have been written in next time. I hope this is helping. I'm sorry about Pablo and his indignant reaction to the UPS man, but that's just part of his way of coping, okay? More to come.